into some of the tear structures. We'll talk about the flow of tears from where they're produced to where they're reabsorbed. And we'll start off by talking about the lacrimal gland. So the lacrimal gland is this tiny gland. It's found in the upper outer corner or the upper outer edge of the eyeball. So just underneath the brow bone, so to speak. And this is the gland that actually produces tears. Now, as you would imagine, tears are important for cleaning the eyes, for preventing dust and particles and bacteria and debris from actually entering our eyes, distorting vision or damaging the cornea. And so that's the purpose of tears. Tears are also associated with our emotional outlet, right? There's some connection there with feeling of strong emotions and eliciting that response of crying. Tears will then be produced from this gland and they'll wash down onto the surface of the eyeball itself. From there, tears are then absorbed into the superior and inferior puncta. So we have the superior inferior puncta, and puncta really are just openings, okay? So we've got one superiorly, one inferiorly, and these are the openings that then reabsorb that secreted tear or those secreted tears back into the lacrimal structures. From the puncta, they drain into the canaliculi. So we also have superior and inferior lacrimal canaliculi. And canaliculi just means a channel or a tube that drains. And so we've got, again, two, one on top, one on the bottom, that is absorbing the tears as they wash across the surface of the eyeball. From there, they enter the lacrimal sac, which is circled here in purple. And then from the lacrimal sac, they drain down via the nasolacrimal duct into the inferior concha or the inferior meatus. And we talked about the inferior meatus in one of our previous labs, but this is basically a connection into the nasal cavity, right? And so this is how we can absorb or reabsorb the tears that are secreted. They're produced from this gland. They wash across the eyeball, collecting dirt and debris and pathogens, and sometimes shed eyelashes. And they are reabsorbed into the puncta, communicated via the canaliculi into the lacrimal sac, and then they drain down through the nasolacrimal duct into the inferior meatus and into the nasal cavity. And this is why when you get emotional or if you're crying and you start getting sniffly, that is the drainage of tears from the orbit of the eye down into the nasal cavity. Let's move on now to speak about the muscles of the eye. So these are the muscles, the main important muscles that actually move the eyeball. And as you would imagine, movement of the eyeball is really important for us to observe the world around us, to take in sensory information. And this happens via 7 important muscles. So we've got 4 rectus muscles, and the word rectus means straight. That's going to be really important in distinguishing these muscles from the oblique muscles, right? Oblique is going to mean at an angle or slanted or not quite straight. So the 4 rectus muscles are the superior rectus, which is on top of the eyeball. So here we go, superior rectus. We've got inferior rectus, which is on the bottom of the eyeball. Again, these are the straight muscles located in these regions. The lateral rectus on the lateral aspect here. And then the medial rectus, you can see a little bit of the surface of the medial rectus, but it's going to be on the medial surface of the eyeball. Again, a straight muscle that's going from the eyeball and running back. And these 4 muscles are going to move the eye in the exact region or the exact location that the name suggests. So superior rectus moves the eyeball up, inferior rectus moves the eyeball down, lateral rectus moves the eyeballs out towards the lateral aspect, and the medial rectus helps you to kind of cross-eye, move the eyeballs inward. The oblique muscles, on the other hand, are not straight. There are 2 of them. There's superior oblique, and we can see here that superior oblique is this sort of pulley orientation where when it contracts, it actually moves the eyeballs down and out, okay? Whereas inferior oblique, when it contracts because of the angle of this muscle, this is inferior oblique, it's going to move the eyeballs up and out. So superior oblique looks down into the corners of the room, whereas inferior oblique looks up into the corners of the room. So kind of opposite to what the name suggests. And then lastly, we've got levator palpebrae superioris. This is the muscle that overlays the superior muscles right here. And this is responsible for opening up the eyelids. So this is what helps you to open up your eyeball, open up your eyelids. Not so much moving the eyeball, but opening the eyelids, which is obviously facilitating light entering the eye. Okay. So here's another view of those four muscles. This is a frontal view or coronal view. We can see the superior rectus here. We can see the superior oblique here. Again, you can see this is at an angle so that when it contracts, it turns the eyeball down. We can see lateral rectus, medial rectus, inferior rectus, and then inferior oblique. Okay. And just to make a distinction here, superior rectus is the muscle that's actually on the eyeball. And then levator palpebrae is the cut surface would be over the top of superior rectus. Okay, so it's not going onto the eyeball, but it's really going to the eyelid. And as I mentioned earlier, it's going to be important in opening up the eyelid. I'll talk about another muscle later on that is going to be the antagonist muscle to levator palpebrae superioris, and that is going to close the eyes or tighten the eyelids.